After the previous section on important and significant global health risks and killers, now we are looking at the public perception and understanding of these risks. Is the public aware of real health risks? How is public understanding of health risks and diseases around us? Unfortunately, many people are not risk literate and are confused by common risks. Improving the perception and understanding of health-related risks is needed to change behavior towards a healthier lifestyle and to improve informed decision-making. In this lecture, we will explore this field from a public health perspective. Indeed, this is an important field as risk perception is connected to encourage behaviors leading to a healthier lifestyle. Let's go now more closely to the field of understanding of health risks. Patients need to understand the risks and benefits of different treatments, screenings, and lifestyle choices so they can effectively participate in the decision-making. However, many studies indicate that individuals frequently misunderstand numerical and statistical notes that are crucial in the communication of clinical data. This can lead to a limited risk literacy. This term, risk literacy, refers to the capacity to accurately understand and make good choices based on risk information. Before interpreting risks and planning any communications or health interventions, people's basic perceptions and frames of reference for interpreting risks must be well identified and understood. It cannot be assumed that the general public thinks in the same terms and categories that are normally used by public health professionals and other experts. In health settings, we can clearly see that risk perception differs between experts and the general public. Health professionals or clinicians do not view the risk associated with a health procedure in the same way as the public. Experts focus on aspects such as effectiveness, prevalence, morbidity, and mortality. For example, there is a great consensus among experts to perceive vaccines as one of the most effective preventive measures to stop the spread of infectious diseases, although they acknowledge some few cases of adverse events following vaccination. In contrast of the perception of experts, the general public may have another one. For example, while experts fully support vaccination programs, some parents are hesitant to vaccinate their kids. While experts understand risks in terms of numerical values and rates, parents rather want to know whether they or their child could be the one in a million who develops the adverse event following vaccination. For example, encephalitis following measles vaccine. In addition, risks imposed to us are far less tolerated than risks that we assume to take. For example, passive smoking or secondhand smoke is not tolerated at all. However, unhealthy fast food is better accepted as we are freely choosing this. In addition, fear to major disasters, such as flight crash, is perceived with a higher fear than car accidents, when the latest are more likely to happen if we check to the statistics. Another important point to consider is that there are elements in risk perception that are of irrational or subjective nature. For example, previous experience. These are central aspects on public perception and understanding of health risks. Not taking into account in health campaign messages the population's understanding of risk is a frequent mistake. The general public, in fact, is composed by a variety of different publics. For example, young and old, women and men, low and high income. Each one of these groups of the population might have particular valid and different risk perceptions and perspectives or experiences for same health issues. For example, young people perceive being healthy mostly by being physically healthy. However, the elderly also perceive other aspects such as independent functioning, mental health well-being as important components for being healthy. In order to explain how risk perception is built, it is necessary to consider several perspectives and approaches: social, psychological, and cultural ones, and their interactions. Risk perceptions is often described as polarized views, such as between expert or scientific understanding and the general public or lay perceptions, quantitative or objective and qualitative or subjective assessment of risks, and rational, analytical, and irrational emotive responses. However, health-related risks perception doesn't follow such simplistic polarized model. It is a highly personal process of decision-making based on an individual's frame of reference developed over a lifetime, among many other factors. It refers to people's judgments and evaluations of health conditions they are or might be exposed to. Indeed, when interventions successfully change risk perceptions, health behavior change is often achieved. So risk perception is considered as a critical determinant of health behavior. Looking to different models, we can briefly summarize them on the following assumptions. Behavior is connected to attitude, which is based on preferences or subjective norms. For example, anti-vaccine parents present a negative attitude towards immunization programs, which is based on own preferences and subjective beliefs, which are not based in science or objective knowledge. Accepting risk is a necessary but not a sufficient condition to engage in health-related behaviors. For example, people know that tobacco causes cancer. However, this knowledge not seems to be enough to quit smoking. Past experiences and past behavior will affect actual behavior. For example, parents who have not suffered from any vaccine preventable diseases and are not familiar with the harms that these diseases may cause will be more likely to become anti-vaccine and not vaccinate their kids. Also, accepting physiological risks may be potentially harmful to psychological risk. Therefore, being unrealistically optimistic in the domain of a health risk, such as cancer, may encourage people to seek diagnosis, which would assist prevention and early treatment. Unrealistically optimistic beliefs that are associated with mental well-being may also be health protective, as they act as resources which allow consumers to cope with negative life events. This shows the important role that emotions play in assessing risk and deciding on behavioral change. These assumptions are not working in the same way for every type of a health risk or disease. Certainly, risk perception includes some particular aspects according to the specific health condition or disease. Let me give you 3 examples. In cancer, family history, age, and the number of previous prophylactic or screening tests will influence cancer risk perception, including how one understands risk information about cancer. Moreover, risk misperception has been shown to both increase and decrease use of preventive health services, and therefore can have significant implications for the health of those at greater risk of developing cancer. In smoking, motivating to quit smoking might be explained by risk perception. In fact, current smokers underestimate their vulnerability to the health risks of smoking. According to a previous research, greater perceived vulnerability predicted the likelihood of a quit attempt and the duration of abstinence 6 months later. And in relation to risk perception of fast food, a study made with college students found that they were well aware of the risk associated with fast food consumption on health. However, their eating habits didn't indicate they practiced what they knew could be harmful to their health, especially when they were socializing with friends. So in this case, risk perception was not a key component for a healthy behavior. Let's explore now other influential factors. In risk perceptions, there exists an important point to consider in relation to what people perceive is not automatically associated with reality, because risk perception has an important emotional component, and therefore it is irrational. From time to time, people worry over something that is very much unlikely to happen, like, for example, being infected by Ebola outside sub-Saharan countries. And at the same time, people do not take actions to avoid some behaviors which are much more likely to injure them, such as cardiovascular diseases or cancer. Health-related risks might be especially difficult to understand when emotions rise, such as when people are faced with a serious disease. For example, people with advanced cancer tend to expect better outcomes and longer survival times from treatment than their doctors do. Such misunderstandings might affect whether patients choose to undertake one therapeutic intervention or another. Past experiences are also influencing risk perception in health. Here, I would like to highlight the antecedents conceptual model of health risk perception, highlighting that health risk perception is influenced by individual differences, such as depressive tendency, gender, or culture. Also by motivational antecedents, such as self-control or self-positive. Also by affective antecedents, such as emotions, positive or negative affective states. And also by cognitive antecedents, such as past experiences, information, accessibility, and others. And finally, by contextual antecedents, such as judgments, alternative information, or framing. So in addition, there are other important factors that will influence health-related risk perception, such as being unaware of the danger of the disease aversion to medicine, and other influences by individual context, such as religion. In fact, it has been found how religion can influence risk perception in health. Religious spiritual persons, when compared to non-religious spiritual persons, report higher levels of psychological well-being, physical health, and quality of life, and lower prevalence of depression, substance misuse, and suicide. And from here, it is time to move forward in the model, so thank you.